In cases of emergencies, such as fire, you should call either 112 or 119 and get help from your RA. There are some fire safety tips you should know.
Now you will learn some fire safety tips for your safe stay. First, turn off the switch and pull out the plug when electronic devices are not being used. Also, you should pull out the body part of the plug instead of the cord part. You should not use prohibited electronic devices such as electronic mats, irons, cookers, portable gas stoves, or other devices with large electricity consumption. You should not bring inflammables into the dormitory such as gas, butane gas, or chemicals. They are strictly prohibited. Smoking is allowed at only designated areas and use ashtrays. Lastly, matches and flammable liquid lighters are not permitted. If a fire occurs, follow next steps. First, you should yell "fire" loudly and press the nearest fire alarm in the hallway. Then call 119. You should explain the details and location of the fire and also provide detailed information if someone is injured. Next, follow next for the evacuation procedure. First, you should swiftly move and open the door, then alert others by shouting. When smoke filled where you are, stay low and place wet clothes or towels over your face and head. When moving through fire, place wet blankets or towels over your head and face to prevent poisonous gas inhalation. Once you evacuate, provide information to the management office. These are some precautions related to fires. First, you should keep emergency exit routes in mind. In case of fire, before opening the door, feel the door with the back of your hand or 2 fingers to guess the heat. If it is hot, do not open. You should keep touching the walls so you do not lose your way out if you are in smoke. Take the stairs and never use elevators. If you cannot evacuate to the ground floor, go to the rooftop and ask for help there. Lastly, if there is a mosquito net on the window, keep it as shown in the picture on the right. To open it, use the handle of the secondary lock as shown, then ask for help by keeping the automatic lock twisted on the left. When you move in, you should be familiar how to open this mosquito net for a safety reason. There are some tips to prevent diseases and fire. In order to prevent diseases in a dormitory, first, you should keep personal hygiene rules, such as washing hands. Do not touch your eyes, nose, or mouth with your hand, and do not use your personal belongings, such as towels, pillows, blankets, cosmetics, or cups, with someone else. You should obviously keep distance from patients. It is important to keep your room clean and often ventilate it. Lastly, you should prevent diseases with getting vaccinated.
If you get a disease, first inform to your RA for instructor, telling specific symptoms like a fever, headache, diarrhea, rash, blisters, or itchy eyes. You should visit a health center or a clinic to see a doctor and notify the RA or the instructor about the result. Upon the result, you would be sent back home or be segregated from others. You should cover your nose and mouth with tissues when you cough or sneeze, and use clothes if you do not have any tissues. Also, you should notify your RA or instructor about the treatment process until it's completed. You should cover your nose and mouth with tissues when you cough or sneeze, and use clothes if you do not have any tissues. Also, you should notify your RA or instructor about the treatment process until it's completed.
If there is a sudden cardiac arrest situation, follow next steps. If you suspect someone is suffering from cardiac arrest, check if the person responds. Tap him and shout, "Are you okay?" and see the response. Ask someone around to call 119 and get an AED. To start CPR, lay the person on the ground and kneel down your body next to the person's chest. To give CPR, place one palm of your hand in the middle of the chest and the other palm on the top of it. Push down at least 5 centimeters at a rate of 100 pushes a minute.
Do this chest compression more than 30 times, and give breaths by sealing your mouth around the person's mouth and blowing before 119 arriving or being conscious. If giving breaths is hard, do the chest compression only. When paramedics arrive and this emergency situation is over, report it to your RA or instructor.